most famous physical therapist on the internet.
Breaker.
Hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, I'm just going to read this. Brad.
Read
Just
it,
the way
Bob.
It is.
Read it.
Does size matter? Question mark. Does disc herniation size predict if surgery will stop sciatica and pain? And we're also going to talk about a few self-treatments here,
That's
too.
right,
So
Bob.
I'm glad you kept this clean. This is a family show, Brad.
Bob, this literally is the title of the scientific study.
Was it really?
We're going to get into it, and let's carry on and get
All right. By the way, if you're new to our channel,
I'm going to clarify everything.
All right, glad you are. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, our website. Go to the giveaway section. We're giving away a knee glide this week. This is the go-to device if you've had knee replacement or knee surgery.
Yes.
Maybe not if you just have knee arthritis. You'll also find it on Facebook. It'll be pinned to the top of the page. The contest, go to Twitter, Instagram, and TikTok for a 60-second version of our program each day. All right, Brad, let's see you get out of this hole you've dug yourself in.
Bob, I was literally looking for research on L4, L5, L5S1 disc herniation and where the most prominent number of herniations are. And I'm looking through the research and I saw this title and naturally it caught my attention because I was concerned about the disc herniation size naturally. Anyways, so I read it and it's like, oh, this is really a good study. We've got to let people know about this because this is not really breaking to me, or you or I probably would guess that this is accurate. I'm
going to tell you why too in just a minute, but this does surprise me a little bit, and I'll tell you of an instance where this maybe is not true totally. But to clarify, just again, I want to make sure we're clear, Brad. What we're talking about is if you have a disc bulge,
right?
Even that word bulges could be.
Would you just clean it up?
All right, if you have a disc herniation or bulge somewhere in your back, if it's a large disc herniation or large bulge, we're saying it does not really matter.
Right.
In regards to whether or not you're going to need surgery. It doesn't predict.
Exactly, right. And that's what this study showed. We're going to go into it.
Yeah, let's go into the details.
It was done by Global Spine Journal, October 2019. This is recent.
So you can look it up.
You really can't get much more recent than this. They had 368 patients.
So a large sample size.
Right. All had MRIs. 95, almost 96% of the herniations were L4, L5, L5S1, which is not unusual.
Those are levels of the back. So
right.
We have 5 vertebrae in the back plus the sacrum. And so it's the lowest levels.
Right. And this is not, nobody would be surprised at that.
No. It's very common.
Yeah. They did 6 weeks of conservative therapy. In other words, physical therapy. After 6 weeks of treatment, only 8.7, almost 9% needed surgery. However, of the people that needed surgery, the size of the herniation was not a factor. I mean, some of them had smaller ones, some had bigger ones.
Sure. So it did not predict.
Right. And you can, look at the study for details.
The exception I want to bring up, Brad, is if you know how we talk about if you have pain and numbness and tingling in the saddle anesthesia.
Right.
That's typically predictive of a really large bulge or herniation.
But that's typically more central.
Right.
Which is getting a little more detailed for the layperson to understand. But one way or another, the whole thing is if you get an MRI and they say, wow, you've got a
really large herniation.
Don't get real excited that you have to get to surgery. I would, assuming the symptoms aren't too severe.
Right.
Which is...
Now, if your surgeon says you need surgery right away because we're worried, it may be killing the nerves or something like that, then you need to have surgery right away.
Or I would go to another surgeon.
I would always get the second
opinion.
Yes, absolutely.
Unless your symptoms, again, are so bad you can't walk, but don't be afraid.
A carpenter sees a nail, he wants to pound it. And a surgeon sees
a bulge.
Surgery,
You
a
wanna-
bulge. He wants to
right.
do surgery, so
So
get the second opinion.
right. So shall we go on, Bob?
Yes, let's go on.
Let's look at this. Actually, we're going to get our infamous
2 cups.
2 cups, which represent L4, L5, or
Right.
L5S1, and we're going to show a model of a disc herniation.
So this is the lower part of the back.
Right.
These are 2 of the vertebrae that
Right.
come out. We took out.
The green squishy ball represents the disc, which is pretty, as a model, it's a good model because the disc has a tough outer layer and it's somewhat flexible, and inside there's a gel substance, and that's what herniates or creates that bulge. And you'll see, we're not going to get into details
It comes
on
from repeated leaning forward or bending forward, and weakens the back of the
Right.
disc, and after a while,
bad posture and seated. But if you see right
yeah,
there,
look at that.
right,
Now, generally, it's off to the side a little bit, and it hits the nerve root,
Right.
and that sends pain down your leg or the sciatica.
So if
So-
we can do some exercises that move the vertebra in such a way that, if you can see, that goes back in, or decompression can sometimes just bringing the force
So in
up.
other words, he's sucking it apart, and you're hoping that will help encourage that to come in too.
Right. So obviously, if you're going to have a therapist, you need to work with a therapist that specializes in this. In other words, as we're big promoters of the McKenzie system,
Yes.
and you can find McKenzie system is a worldwide system. I believe it's in over 40 countries. We actually have a video how to find a McKenzie trained therapist, and if you go Bob and Brad, put that in there, you'll be able to see if you have a therapist to specialize in that near you.
And McKenzie is spelled McKenzie.
Right, capital
So,
K. Yeah.
Capital K.
Yep, and so that can
So-
help you out.
Yeah, and I mean, we have no ties to them. We've been fans. I mean,
We're both trained.
We're both trained
Both
in it.
trained in it. We've literally seen the success.
I've sent people when I don't, if a family member or a friend will call and say, "Can you recommend a therapist?" I'll say, "Look up to see if you can find a McKenzie therapist nearby
Right.
you."
Right. Exactly. So that's.
By the way, what you failed to mention, Brad, too,
Oh.
is that this was also supported by other studies.
right.
That-
Exactly.
That there, other studies have also shown that the size really didn't matter. The end result could be good, positive, or negative. It doesn't really matter what the size is. I
right.
mean,
Exactly. It's how
so
you
don't panic. is
Right.
basically what
So
we're saying.
the big thing is correct your posture.
Yeah.
If is your posture slouched when you sit? Do you sit in a couch or a recliner that promotes? It's a fluffy one, or it's all wore out, and it promotes poor posture. You've got to get rid of that stuff, or just quit using those. Get to some firm chairs.
Lying on a mattress that sinks in. It could be the
Exactly.
same thing. You got to avoid that flexed posture.
Right. The patient you and I worked with, we could get his symptoms to centralize,
Right.
get better, but he would sit in this car with poor posture. It was hard to.
And he didn't seem to buy into the fact.
No.
Yeah.
And the problem was we just didn't get enough visits with him.
Right, because of COVID.
COVID, yeah. So we were restricted a little bit there.
So we're going to talk. Said you, Brad, that we're going to mention some self-treatment, right?
Well, that was one of them. That's an extra posture. Make
Right,
sure your
posture,
posture.
yes.
Avoid bending. Avoid picking things up. So you're gonna do like
Picking things
this.
up incorrectly.
Right. Exactly. Really be careful with what
We
you're
got
doing.
a whole host of videos on this. We just want to touch upon some of the things that we cover in those.
Yeah. Exactly. We made like 40 videos just for sciatica.
Yeah.
And that's
it's on our website actually. It's going to be on our website.
yeah. It's
Another
almost
program.
there.
It's almost there.
Right.
Well, a week or two.
But the one thing you can try is a decompression. Now, in the olden days, it was called traction, and you'd have to go, to the doctor or to the therapist, and they'd hook you up on a traction machine. But you can actually do some self-traction, and if it works, you'll know because things will feel better right away. So, should we show them
Yeah,
the
it's
first
something
one?
you can actually do throughout the day if you want to. You can actually just take a couple of chairs and get down, and you might put pillows underneath your knees if you want to, but I don't need to. This is kind of a
Yeah.
softer floor.
If you're on carpet, you're all right.
But I'm going to go ahead and just raise myself up, and I'm relaxing my midsection at the same time, And that's that's separating the spine. And if I'm having a painful bout and I try this and it gives me a half hour or an hour, hey, that's
Half
great.
hour of relief.
Right, of relief, right. And the other thing is, this isn't the worst thing to do before you do. We're going to show you extension and line.
Right.
The exercise. This isn't a bad thing to do prior to that.
Right.
To
Exactly.
try to get the back in a good position.
As a matter of fact, we just had a person made a comment, and she was actually doing the hanging. She said it gave her relief, which we're going to show.
We'll show that at the end.
Okay.
Always show that at the end since we got to walk over there, and which we got to mention walking too.
Exactly.
So anyway, do this. 30 seconds. That's probably plenty long. You can also do it on the back of a park bench if you're walking around the lake or something. So
right. Well, we can't do it here, but whatever you're going to do, you're going to get the weight.
Do it here, Brad.
Well, Bob's taller. He can. You can do this on a cupboard at home.
Yeah, you can actually lean like this, and my toes are just barely touching. And I'm taking again the pressure right through the spine, elongating the spine.
And I can't emphasize enough. You're only going to do these if, when you do it, it immediately feels better and it takes the symptoms out of your leg. If it makes it worse or makes the leg pain worse, it's not the right thing. You have to go to another option.
Yeah. Now you can do what I alluded to earlier is extension and line. I'm going to go ahead and lie on the floor here, and you can start off. This is a whole system. I'm just going to barely touch upon this, Brad, but you can start off on pillows, work to no pillows, work to up on your elbows, and then work to press ups like this,
right?
Micro press ups, and then eventually to full press ups like this. I just don't want to get into detail, Brad, because
we just go to one of our videos on sciatica.
Yeah, treatment of sciatica, and we'll go into it in better detail. Why don't we talk about the walking, Brad?
This is a treatment that most people will be able to do unless you really have a severe case. But if you can walk on a flat surface and it feels good, do more of it.
Yes, the more the better.
Yep, 2-3 times a day, get out and do some walking. Don't walk so far that you can't.
You get caught out there, and you can't make it back.
Right. So you're going to limit it and then progress it as tolerant. It should feel good. If walking feels good, do more of it.
It's like the old joke about the English Channel. The guy swam halfway out, and he got tired, so he swam back.
Let's go on to the next one, Bob.
Yeah, we're going to show the hanging handles, right?
Right. So at home, if you have like a bar to do pull-ups, we use the hanging handles because that works. But anything that you can hang or suspend your weight safely, you can do that for decompression.
You want to move the light over, Brad, and I'll hang? Yeah. So we sell these. You get 2 anchors that you put into the studs, and then you get these clips and the handles. And this hanging is really great for shoulder problems and for back problems. And also, I think it works well on your posture.
Oh, right.
I do this. I did this yesterday because yesterday was my work day inside where I do a lot of, and I do this every hour for sure. I try to sometimes do it even more often, but my back always gives a little crack when I do this just from sitting. And it looks like I'm not even I'm taking weight, but I'm hardly taking any weight at all on my feet.
Right. And if you do this and your back hurts or your leg gets worse, do not do it. Only do it if you feel better and your back feels good.
Right. Exactly.
That's very critical that you follow that rule.
Yeah.
Okay, Bob. And we do have some other videos on details of decompression. There's actually a couple of options. So you can go Bob and Brad. Decompression, and you'll get that information too. So Bob.
In other words, keep watching our videos. By the way, we can fix just about anything.
Except for
a broken heart. But
this?
No,
this doesn't.
nothing to do with it.
Yeah, nothing to do with it.
All right. Adios, folks.